Welcome to r/Credit by Haunted TTS. Subscribe and like this video for more, and don't forget to click that bell button for notifications. Doctors, nurses, what was the most, how the FCK are you not dead patient you dealt with? Case number 2, my best case ever. A young woman, in her 30s, had a stroke. She clotted off the basilar artery, the big artery in the base of the brain that supplies all of the primitive functions, like breathing and awareness. I found out about her a day after the event. This, by the book, is a hopeless case. She was literally already dead. But, because she was young, they prevailed upon me to do something. I poked a catheter, a long skinny plastic tube, into her groin artery, then snaked it up to the blocked artery in the base of her brain. I infused a clot-busting drug into the artery for about 12 hours. I rechecked, and the clot was gone. She woke up the next day. After a month, she literally walked out of the hospital. She sent me a nice card a month or so later. It bothered me that her handwriting was better than mine, even after her stroke, but I was pretty happy. During my M rotation, I had a road accident, flesh wounds as deep as his intestines were out, around 40% of his face was scrapped off, one eye was out of the socket, the right forearm had ripped off muscles and you could see the bone. Now the miracle is that the bleeding somehow had stopped, and when I came in, I saw his chest moving and him holding his intestines. I was like, yeah, wow, this guy is alive. We helped him, stitched everything back, the face was reconstructed, and now he is alive and well. Had a patient with an internal temp of 75 F. He was drowsy, but fully alert and oriented. He was found in a river embankment in the middle of winter. He had been lying there overnight, before he was found by a dog walker. We didn't believe the equipment when it told us 75 degrees, so we repeated with a rectal thermometer, then a different rectal thermometer, and then a rectal probe attached to the bedside and Meditherm system. They were all consistent, and after several hours of heating measures we got their internal temp up to 90 degrees, before they went to ICU. The second how the FCK are you not dead patient was a person who had a blood sugar of 1800. They weren't in a coma. Just a woman who walked in to complain about abdominal pain. We had a patient come in after mowing the lawn. Patient said something was kicked up by the lawn mower and hit him in the head. Didn't think much of it, finished cutting the grass. Still had a headache a few hours later, so came to the ER. We CAT scanned his head and there is an entire nail embedded in his brain. He had the tiniest abrasion to his forehead and no neurodeficits. He had no idea. Everyone was absolutely dumbfounded. We had a guy who'd lovingly crafted his own gladius sword and thrown himself on it, piercing the sternum and his heart, but he was alive and conscious, and every time his heart beat the handle of the sword vibrated. There was a guy I looked after who'd thrown himself in front of a train in a suicide attempt. The train pretty much cut him in half. It was bad, and he was not happy to have survived. I'm still not clear how he did. I used to work in obstetrics in the preemie ward. I've seen some extremely premature babies that looked like they were barely hanging on. Tiny head maybe 2 inches from chin to top of the cranium, purplish reddish translucent skin that looks paper thin, eyes closed, not responsive, limbs smaller than a finger, and always extremely skinny. They often face lifelong problems due to being born so premature. I remember once asking the doctor why we even bother at that stage, since it looks so hopeless, and in some cases, is, frankly. She said, and I remember very well the preemies that were hopeless cases 20 years ago now live normal lives, so that is why we keep on pushing. My ex-boyfriend is a ski instructor. He told me that one day, all the slopes were extremely icy and many people were coming in with injuries. He had fallen badly and returned to the ski lodge. He was checked out and said he felt fine. Fortunately, a paramedic happened to be looking at him when his helmet swung open on the side because it was very badly cracked. They took a 9-year-old girl with a broken femur off a stretcher and put him on it and took him to the hospital immediately, where they found he had broken his neck and needed immediate surgery. Amazingly, he is mostly fine, except for now having acid reflux for some reason. We once received a patient that was bitten by a rattlesnake twice. He only managed to get to the emergency ward 3 hours after being bitten. Then to make things worse, we only managed to get the correct antivenom flown in 1 hour after his arrival. He now works at our hospital as an admin clerk and is healthy as ever. Not me, but my mom was an ER nurse right after college. A family got in a car crash and there weren't any serious injuries, they were just taken to the ER to be assessed. They had a baby and my mom was asking them questions about its health, etc. When she asked what the baby was being fed, the mom said juice. Just juice. She had heard that at 6 months, you can start feeding the baby juice. Not realizing it was juice, in addition to baby food or milk. This woman had been feeding her baby only juice for months. Not a doctor, but I was at a fencing meet when my instructor forgot to step aside and the sword went through his mask, through his mouth, and out the back of his head. Missed anything important and he was perfectly fine, other than having a sword through his head. I had extensive osteomyelitis in my foot from an infection the year before. I had done 89 days of outpatient IV vancomycin for MRSA then, and I was in heavy denial that the infection had returned. Due to the dead bone I had been told when the infection returned, not if. I was sleeping about 20 hours a day and could barely function. Finally, after my wife threatened to divorce me if I didn't act, I went back to the outpatient clinic to go back on IV meds. I rode there on my motorcycle, in the rain no less, and go through the error to get back into the outpatient program. The first thing they note is my pulse oximeter readings are 68, they usually start freaking out at anything under 90. Next, my blood pressure crashes to 78/40 seconds. I am rushed by ambulance to a major hospital and found to be septic and an early stage organ failure. I vaguely remember an ER nurse who was very nice to me, but it was mostly a blur. 2 weeks later they amputate my right leg. A couple of days later a nurse comes to visit me to tell me I was the politest corpse who ever passed through her emergency room and she was happy to see me on the road to recovery. While a student did a clinical placement at a major trauma hospital where they kept a collection of X-rays you never usually see because the injury would typically kill the patient instantly. Most interesting one was a smashed pelvis from a jockey in a horse racing accident. That kind of injury would usually also result in rupture of femoral arteries which means you bleed to death very quickly, but somehow this guy survived and made it to hospital and lived long enough to get X-rayed. Don't know if he recovered though. We were the closest hospital, so they brought a civilian in, former AF medic. His safety gear failed and this guy fell 128 from a communications tower. It had rained the night before and he fell into a marshy puddle of high grass, flat on his back, concussion and whiplash. No broken bones, but the bruises that covered his body from head to heel were something to behold. He spent a week in the hospital before he could move comfortably. I'm not a doctor or nurse, but the doctor who saw my mom said he had no idea how she was alive. Years ago, my mom was having gastrointestinal problems. She had incessant stomach aches and was bound up something awful. After 3 days of not being able to poop, she went to the doctor to get checked out. After a thorough examination, the doctor determined that her gallbladder needed to be removed immediately. The next day, after the surgery, my mom comes to and sees the doctor standing over and he wasn't happy. Your gallbladder was dead, he said. Like, dead. In fact, it was completely gangrenous. Had you waited another day to see me, you would have died. Had it ruptured during surgery, you would have died. That was the worst, most stress-inducing surgery I ever had to perform in my 20-year career. No offense, but I hope I never see you again. And he walked out of the room. I had a hemorrhage I didn't know about. I had seen some blood, well wiping that was a bit more than I chalked up to wiping too hard. Went to a physician and he checked my anus and told me I had hemorrhoids that I had probably agitated. Recommended I use baby wipes in preparation H. Well, 2 days later, I had started feeling very nauseous with a nasty headache. I slept right up until it was time to go to work and so decided I shouldn't call off. About 5 hours into my shift, I go to take my break and use the restroom. The moment I pushed, I passed out and fell off the toilet to be found by my coworker however much later. The MTs are loading me up and start taking my vitals, my O2 levels are low AF, and when we got to the hospital, they rushed me through the back and into a room. They say I need blood pronto, and I remember passing out again. The next thing I woke up to was an RN throwing my curtain open and shouting, "Why isn't he hooked up yet?" Apparently the ball was dropped somewhere between getting my blood type and the blood dropped off. So I sat there for over 45 minutes needing blood and that RN was madder than hell. Finally get hooked up and I took 3 pints of blood, stayed overnight and needed another pint by the next afternoon. Hemorrhage was found, microsurgery performed and I've been fine ever since. The same RN came to see me after my surgery and told me she was terrified I was going to die when the EMTs handed over my vitals when dropped off. My mom was a critical care nurse and said the freakiest thing she ever went through was having a 15-minute conversation with a little old lady who had no pulse. As I recall said little old lady passed mid-sentence. Just stopped. Not a person, but when I was a kid our cat went out with 4 legs then just strolled back home, not showing any signs of anything being wrong, with 3. No blood. Emergency vet didn't believe my mother when she called, but agreed to see her anyway. Surgery the next day, to do whatever to stitch the hole, she lived happily as a 3-legged cat after that. Not a nurse, but this is a cool story. My dad has a blood condition that makes him prone to clotting and it has sent him to hospital several times now. The most recent case was this. He had started doing nightly runs, raising money for a charity, and every time he came home, he'd be more and more puffed out with a really sore leg. He mostly just thought it was muscle cramping until at one point my mum just told him to check it out in the doctor. Doctor almost immediately told him to go to hospital as soon as he described it. Hospital took him in, sent him for an MRI, I think, and in the nurse's words, they stated it was the largest blood clot they ever saw in a person that was still breathing. So that was a fun week. The first time I witnessed a pulseless TACH patient. TACH equals ventricular tachycardia, one of the worst things your heart can experience. He probably did have a pulse and was just super weak, but we couldn't feel one. The guy was awake with no complaints other than being cold. He was pale as I've ever seen a human. And he was that way for 2 hours before we got a cardiologist in. We cardioverted him a few times similar to using a defibrillator, but has some specific criteria. Even though we couldn't feel a pulse, he was awake, so we followed modified advanced cardiac life support protocols, but didn't want to sedate him too much with Ativan because, well, it's better if he didn't go to sleep lol. We all hovered around his room awaiting for him to pass out finally, so we could start CPR. But nope, he just kinda hung out, watching Wheel of Fortune waiting to literally drop dead. 18 years ago I went into the to get a cyst lanced open. 3 weeks later I felt pain in my back. I went back to the and they found nothing. Only did x-rays. I felt weak leaving so went home and crashed on my couch. I woke hours later and tried to get up and fell. I went down fast. I called an ambulance and went to the hospital. I sat for 6 hours until finally someone came to check me out. I had a 105.0 fever. They immediately rushed me into MRI and lo and behold I have MRSA inside my spine. I was rushed into surgery and now live from a wheelchair. T5 to T11 infused. The doctors said if I waited one more day I wouldn't be here. I did 16 weeks of vancomycin through IV. 3 hours twice a day. I'm truly lucky to be alive today. I'm not a nurse, but I did work as a stock tech in the critical care or at the hospital I work at for a while a few years back. I heard the call come in and all of the staff rushed to prepare a room for an incoming patient. When they came in off of the elevator to the live flight landing pad, I saw this kid, probably 16-ish, get wheeled in with paramedics completely surrounding his head in particular. I figured he just had some sort of severe laceration they were trying to keep from bleeding, as there was a lot of blood. They took him into a room and I followed with a feeder cart. That's when I saw his head, or more accurately, what little was left of it. Basically the entire front half of his head was completely missing. Eyes, nose, jaw, tongue, forehead, everything. The nurses around his head were desperately trying to hold his brain in while he was intubated. Apparently he had attempted suicide via shotgun to the chin. The worst part was, he was still alive. He was groaning, gargling, wiggling his hands and feet, and it seemed he was still very much aware of what was going on. I had to move on to other areas of the unit, so I'm not 100% sure what happened after that, but I seriously doubt he survived much longer after that. I can't even imagine what that must have felt like. Poor kid. Not a doctor or nurse here, I'm a lab tech, but when I worked at a hospital in Connecticut we had a patient come in complaining of weakness and dizziness. The nurses told us later. We ran a test called a CBC as the doctor ordered. The hemoglobin was 2.8. The patient should have been passed out hard, but no, I was told she walked in on her own. Not a provider, but used to work in the Hard to narrow it down to one, but one morning a guy drove up to the doors, pushed his dead girlfriend out of the passenger door onto the sidewalk, and drove away, bad heroin, that he had given her. 2 hours later, she was awake and whining for that same boyfriend. The nurse angrily explained the situation to her and said, "You were dead because of him." She said, "Meh, ain't my first time. Narcan is something else." The other would have to be the 13-year-old caught in a gang-related shooting. Her entire torso was covered in bullet holes, several in her throat. She was raggedly breathing through several of the holes. A month later she walked out of the hospital. Patient on hospice. Advanced cancer. Limbs literally rotting off. Lasted that way 2 weeks. It shouldn't have been possible. It should not have had to happen that way either. Horrible memory. As a lab tech, I had one I dubbed Everything Guy. He was complaining of a sore stomach after coming home from overseas, so got the usual "what were you doing?" questions. He was in West Africa. Didn't bother to get anti-malarials. No vaccines. Admitted to eating bushmeat. Also said he thought it was undercooked. Drank water from a local source. Turns out this was directly from a river. Without filtering it. River was apparently badly polluted. Hired prostitutes while there. didn't use protection. He basically saw everything you shouldn't do on holiday and used it as a checklist.